Here's a picture of what happens when you digest carbohydrates and proteins. See, carbohydrates and proteins are different than fat in terms of the digestive process, okay? They get smushed around in the stomach and mixed up, and then with all the digestive fluids, and this is, creating surface area for the enzymes to get at them. Stomach dumps them into the small intestine. In the small intestine, they arrive at the brush border for absorption, but they cannot be absorbed unless they're in a single form. They arrive in a dipeptide and a disaccharide form. So they arrive as either two amino acids or two carbohydrate entities linked together. They can't cross like that. That's not how the system is designed. It can only take across a single unit, either a monopeptide, a peptide, or a monocarbohydrate. So what our body does is at that brush border, it releases dipeptidases and disaccharidases. Now, if we have damage to the small intestine, or we have a leaky gut, or we have some kind of digestive disruption there, and we don't have a healthy release of those enzymes, those will sit there. The dipeptides and the disaccharides will sit there, and they will become fuel for whatever bacteria is present. Now, do you need to have an overgrowth in your small intestine or SIBO for this to happen? No, not necessarily. If the fermentation problem, meaning gas production in the upper GI, is really caused by pancreatic insufficiency, perhaps, or brush border deficiency, then no antibiotic is going to fix that. No antimicrobial treatment is going to fix that. What will fix it, the real cause of it, obviously you can add in some of those dipeptidases and disaccaridases in a supplement form. But that's not going to fix the problem. What's going to fix the problem is to heal the gut. And the way that I do that successfully with my patients is by using sulfur, by using the GI1 powder, because sulfur is what gives us cellular connections. Sulfur is what allows for stretch and recoil. Sulfur bonds are the only bonds in our bodies that are structurally paramount in holding us together, but not just inactive holding. It actually stretches and recoils. So think about motility. Think about the mucus lining would not exist without sulfur. Your connections, your cellular connections, would not exist without sulfur. So I use the GI1 powder to heal that. And at the same time, it's acting as a gentle antimicrobial and antifungal. So really, I think that's why we get such great results using that. I want you to be well.